This next topic, it is a serious one and an important one. Today, we are talking to Dr. Andrew Little, a neurosurgeon at Barrow Brain and Spine, about brain tumors. And you're here really to educate us through a brain tumor diagnosis. That is so scary. First off, you hear that, you go, oh my goodness. But you said settle down. Take a breath and go and know what you need to. So let's talk first about the common types of brain tumors.
Thank you, Susan. Thank you. It's a pleasure to be here. I'd like to describe to you the three most common types of brain tumors. So I have a model here of the brain for you. And on the outside of the brain is a hard covering called the dura, which means tough mother in Latin. The most common type of brain tumor arises on the outside. It's called a meningioma. Meningioma, which is most often a benign type of brain tumor. Now, other types of tumors can arise from inside the substance of the brain itself. Those are called gliomas. And there are many types of gliomas also, from benign, meaning not cancerous, to malignant, meaning cancerous. And even deeper inside, I'm going to remove the brain here for you.
I'll turn this down for you this way.
Thank you.
You're welcome.
Thank you. And deep inside, there's a part of the brain here called the pituitary gland. And the pituitary gland is the master hormone gland in the body. It's usually about the size of a pea. And it makes 8 different types of hormones that touch every organ system. And some benign tumors originate there, and that's one particular interest of mine.
Half of those names none of us probably understand. You know, we just hear the word brain tumor and we get very, very nervous. But how is it diagnosed? How is a brain tumor diagnosed?
Well, the good news is most of the brain tumors are diagnosed incidentally, meaning a patient has a MRI scan or CT scan because of some other complaint or concern, perhaps dizziness or headache. It turns out to be unrelated to the brain tumor. So you'll see here on the screen, there are 2 MRI images. This one here, and this is a pituitary tumor, which is a benign tumor at the base of the brain that causes vision loss. And this one here is a meningioma, which is pushing on the brain. You can see pushing in the brainstem over.
Well, you talked about symptoms. So are we going to feel a brain tumor?
Well, there are many different symptoms that can arise from brain tumors, and it depends on really 2 factors. One is the location and size of the tumor, so whether it's pushing on a particular brain structure, or if the tumor is making hormones which circulate around the body and cause other changes. So, for example, I could show you again here on the brain. A tumor can cause symptoms by causing pressure. So, for example, this part of the brain right here is the part of the brain that controls the motor function on the opposite side of the body. Sure.
Okay.
There we go.
So that's the motor skills. That's our speaking. That's our ability to remember.
No, it's the ability to move our arms and legs.
Okay, so just the movement. Okay.
That's right. So a tumor that originates from that part of the brain, for example, could cause weakness on the other side of the body.
Okay, so what about speech or vision, anything like that?
Sure, absolutely. So the speech center of the brain is located in most patients on the left side. So that would be over here. And that's in several different areas of the brain. And so tumors that originate from that part of the brain or cause pressure can cause difficulties with speech.
What kind of treatment options are out there? So we get the diagnosis, how do we treat it?
Well, it's important to make sure you have the appropriate team in place because there are many different types of tumors that have many different treatment options. So having specialists which are interested and excited about treating your particular condition is important. Most treatment teams include a neurosurgeon, somebody like myself, who can offer an opinion about whether surgery would be helpful. Also radiation doctors and chemotherapy doctors.
So it really is important to go to the right type of doctor, correct?
The right type to at least engage you with the right team.
Okay.
It's important to have an experienced team who has access to clinical trials, new investigations, those kind of things.
But if you just hit your head, you don't have to assume you're going to have a brain tumor.
That's right.
Okay, because you said that's a myth a lot of people have.
It's a very common myth.
You get a big hard hit on your head and you assume something terrible is going to happen. We don't need to assume that.
We don't. In fact, that's a very common myth that patients often ask me is, when I struck my head when I was 5, is that what caused the brain tumor? The answer is probably not.
Right. Well, that's very good information. Thank you so much, doctor. We appreciate you. If you would like more information about brain tumors and treatment options, please visit barrowbrainandspine.com or give them a call for an appointment, 602-406-3181 if you've got questions.